In-depth coverage of the top stories and breaking news when it happens. News Radio 1080 KRLD.
It's another great reason why you might want to drop a few lbs for your heart health. There's new research that finds weight loss is a good thing for your heart over the long run. But the better news is you don't really have to sweat it if you put some of that weight back on. We're joined by Dr. Fahmi Farah. She's a cardiologist at Bentley Heart Health. She's in the KRLD Zoom room. So tell me about this. What is the issue here as far as, let's talk first about weight and how it affects your heart.
Obesity is one of the risk factors for cardiovascular disease. As you know, obesity increases risk factors in many other ways. People who are overweight, they're at risk of having diabetes. Those who are already diabetic, if they're overweight, it becomes very difficult to control the diabetes. Overweight people are also at increased risk of having things like high blood pressure, high cholesterol, and as a result, cardiovascular disease increases with, plaque building up in the coronary arteries, which are arteries that supply blood to the heart, and that's what leads to heart attack. Same thing with stroke. Stroke is, blood supply getting cut off to the brain. That's one type of stroke that's called ischemic stroke, one of the most common types of stroke. That's also increased in those who have obesity.
When people lose weight, they tend to improve their heart health, and a lot of people will be worried that if they put the weight back on, that their hearts are at risk again. But this study seems to indicate that's not necessarily the case. Correct.
Weight loss is always encouraged, and any amount of weight loss is going to help with your cardiovascular risk factors. And you brought up a very good point. There's a study that looked at more than 50,000 people, and we saw that after loss of weight, even if they regain some of it, they will still maintain a lot of the healthy effects of that weight loss. For example, the reduction of risk factors that we're talking about, it reduces the acceleration of plaque buildup in our system. It also reduces inflammation in the body. So what we're talking about is not necessarily regaining the whole amount of weight, but a portion of the weight. Even if you regain some of it, you're still at benefit.
Is there a risk to your heart of being too much underweight?
Well, yes. To short answer to that is yes, in the sense that for those who have eating disorders such as bulimia and anorexia, those are very damaging to the heart and could be life-threatening at times. Anorexic patients can often die from certain cardiac death from electrolyte abnormalities. So yes, the short answer to that is yes.
Dr. Fahmi Farah is a cardiologist at Bentley Heart Health.